What if I told you that when it comes to asthma, the real problem isn't breathing too little, but maybe, just maybe, it's breathing too much? Today, we're going to dive into something called the Buteyko Technique, and it really turns our whole understanding of breathing completely on its head. We're always told, right, take a deep breath, calm down. But what if, for asthma, that's actually the worst advice you could get? It leads us to this really surprising question. Could breathing less be the key to actually breathing better? It sounds wild, I know. Okay, so this is where it gets super interesting. The whole idea behind Buteyko is that a lot of people with asthma are kind of stuck in this hidden cycle of overbreathing. Now, we're not talking about dramatic, movie-style gasping for air. It's more of a subtle, constant habit of taking in just a little more air than your body actually needs. And that, believe it or not, can make your symptoms so much worse. So you end up in this crazy paradox. You feel breathless, so what do? Your first instinct is to breathe more, to take in more air. But that just makes you feel, well, even more breathless. It's a vicious cycle. But thankfully, there's a technique designed specifically to break you out of it. So what in the world is the Buteyko technique? Honestly, the best way to think about it is like a toolbox. It's packed with all these very specific exercises and strategies, and they're all designed to do just one thing: help you retrain those automatic breathing patterns so you can take back control from your asthma. So how does it all work? Well, it really comes down to three main ideas. First up is reduced breathing. This is all about learning exercises to consciously make your breathing lighter, slower, calmer. The second big one is nasal breathing. You gotta breathe through your nose, not your mouth. And third, and this one might surprise you, are lifestyle strategies. We're talking about things like taping your mouth shut at night, all to make sure you're only breathing through your nose while you sleep. Okay, so it all sounds pretty good in theory, right? But the real question is, does this stuff actually work? Let's take a look at what the science, the clinical evidence, has to say. You don't have to take my word for it. This quote from a really big study in a medical journal called Thorax pretty much sums it up. The research consistently points to two major benefits. People feel better, and they use their reliever inhalers a whole lot less. And it's not just one study either. Multiple trials have backed this up. People consistently report that they just feel better, and they find themselves reaching for that blue reliever inhaler way less often. Some studies even saw patients being able to cut back on their daily steroid medication, which, as anyone with asthma knows, is a huge, huge win. All right, so with all these pretty impressive benefits, you've got to be asking the big question. Is Buteyko a cure for asthma? Well, the evidence is actually very clear on this, but the answer, it might surprise you. And here's the reality check. This is the key distinction you have to understand. Buteyko is absolutely fantastic for managing your day-to-day symptoms, improving your quality of life, and helping you cut down on medication. But, and this is a big but, it doesn't change the underlying disease itself. So if you go get a lung function test, those numbers probably aren't going to change much. And here's another really important point. While Buteyko is definitely effective, other breathing exercises, the kind you might learn from a physiotherapist, can be just as good. So it seems like the real key is the focus on controlled, calm breathing itself, maybe not one single specific method over another. So, after all that, what do the experts say? The people who write the official medical guidelines. Let's get their verdict. We're going straight to the source here. We're looking at guidelines from the British Thoracic Society, which is a major authority on all things respiratory health. And their advice is based on looking at all of the science out there. And what they've done is give Buteyko a grade B recommendation. Now, what does that mean in plain English? It means there's good evidence to support it, and it's something that doctors should seriously consider for their patients. It's a solid endorsement. So what does this all mean for you? Well, first, it's pretty clear it can help with your symptoms. Second, and this is absolutely crucial, it's something you do alongside your regular medication, not instead of it. Never stop your prescribed inhalers. And third, just be aware that learning how to do this properly often means paying for a special course, so you've got to factor in the potential cost. So, after going through all of that, what's the one big thing you should really take away from this whole explainer? The evidence seems pretty clear. When it comes to managing asthma, how you breathe can be just as important as the medicine you take. By retraining something as simple and fundamental as your own breath, you might be able to gain more control and rely less on medication. It's just a powerful reminder that sometimes the biggest changes really do come from the simplest adjustments. Makes you think, doesn't it?